good news today for many Americans who may be suffering from what's called advanced kidney cancer. Joining us today is Dr. Mayor Fishman of the Moffitt Cancer Center in Tampa. Good morning, Dr. Fishman.
Good morning, Paul. Thanks for having me on a Good News broadcast.
Good. Now, why don't we start by just talking about advanced kidney cancer? Now, this is not like a widely or a widespread disease. What exactly is the prevalence here in the United States?
There's about 50,000 cases of kidney cancer each year in the U.S. and about 13,000 deaths. So as far as advanced kidney cancer, well, certainly all the deaths and maybe some of the other cases as well. So maybe 15,000, 20,000 patients each year.
Oh, all right. So, while it's not talked about a lot, maybe it doesn't get a lot of media coverage, this is a significant disease.
There's certainly many people with kidney cancer, although it's not one of the top three major cancers. Yeah.
Okay. Is it highly treatable? And if so, what are the treatments?
As a group, patients with kidney cancer are very mixed. Some patients can be treated for cure with surgery. Some patients with metastatic disease may enjoy a very good survival. Other patients with metastatic disease may need treatments and may ultimately die from the cancer. So it's a wide range.
Okay, and what about, are certain people at high risk for getting this type of cancer?
There's about 2-to-1 male predominance, and the median age is about 60 or 65. So that does identify a somewhat higher risk group. On the other hand, patients at younger ages are routinely seen with kidney cancer. So it really strikes a wide range of patients.
Okay, and I understand that the FDA recently approved a new treatment for advanced kidney cancer, and it was given priority review. Could you explain what that is, why the drug was given priority review, and why this FDA approval is significant?
Well, until very recently, there have been almost almost no drugs to treat kidney cancer, which was metastatic. More recently, the targeted group of drugs has had some approvals in kidney cancer and in other cancer types as well. 2005 and 2006, a couple of the drugs that block a protein pathway called VEGF were approved. 2007, the first drug blocking the mTOR protein was approved, looking at some high-risk patients. And this current approval was for patients who'd failed after one of the VEGF drugs, now being treated with this new Afinitor drug blocking the mTOR protein. The FDA can give a priority review in any situation, but especially looking at the unmet need such as this in kidney cancer. I can't speak for the FDA, but I think that was probably a factor for getting a priority review and trying to get the drug out and available for patients at an earlier point.
Okay, so in other words, this new treatment, Afinitor, was given this priority review because there were certain patients who would fail to respond to the currently available treatments prior to this approval.
The pivotal trial using Afinitor was designed with this unmet need in mind, looking at patients who had spread of the kidney cancer, who had been treated with drugs directed at the VEGF pathway, and who still had progression after that. So that's a key current need. I anticipate over the future we'll learn new ways to use this drug, maybe in combinations or maybe other drugs blocking the mTOR protein.
Okay, and then finally, this drug, you say it blocks this mTOR protein. Why is that significant? How does that help fight the cancer?
Yeah, the function of the mTOR protein, which is in all cells, is to help the cell grow and divide and recruit new blood vessels. And these are things that cancer cells seem to depend on a lot. So blocking the mTOR protein really seems to affect the cancer cells more than other cells. And they've been able to get the rate of progression to improve using this type of medicine.
All right, so this is great news for treating clinicians as yourself and for those patients out there that may not respond to the other available treatments.
Yeah, we're very encouraged to see a lot of attention from pharmaceutical industry developing new drugs in kidney cancer. An individual patient, of course, will need an individualized treatment plan and can discuss it with their physician.
Great. And if people want more information about kidney cancer, where could they go? Do you have any websites?
There's some good internet resources. Cancer.gov is the National Cancer Institute website with information on a lot of diagnoses, including kidney cancer. And curekidneycancer.org is the website for the Kidney Cancer Association, and that's also an excellent resource.
All right. Thank you, Dr. Fishman.
Thanks for having me on the program.